We're going to go ahead and get started with our Responsible Gaming Forum. All right, good morning and welcome to the Massachusetts Gaming Commission's Forum on Responsible Gaming. My name is Mark Vanderlinden, and I'm the Director of Research and Problem Gambling with the Commission. So I started with the Commission almost exactly 4 months ago. Before that, I directed problem gambling treatment and prevention services with the Iowa Department of Public Health. I have to say that even before coming to Massachusetts, when I was in Iowa and working there, I also, at the same time, I sit on boards for the National Center for Responsible Gaming, and as well as the Association of Problem Gambling Service Administrators. And in all of these various roles, I had a chance to see what was happening across the country, what was happening in terms of problem gambling and responsible gambling in different jurisdictions. I saw the issue of expanded gaming coming up in Massachusetts, as it was evolving. I had been hearing from different people, and so it wasn't really all that surprising to hear that it had passed, that Massachusetts was going to offer casino gambling, was going to then also open a slot parlor. What was surprising was the information that was bubbling up about how they were going to go about doing this. What first caught my attention was obviously the amount of money that was being talked about, of what was going to go into a public health trust fund to mitigate problems that would be connected with problem gambling. And problem gambling treatment, problem gambling prevention, research, pretty much unprecedented in the country. As time passed and I joined the commission, there's other pieces that had caught my attention as well. And paying attention to the comprehensive statute, directing us exactly how we need to move forward as we do this, the direction that's given to the commission was very thoughtful, very detailed. That in turn has translated to an incredibly rigorous application process, a very intentional and aggressive research agenda, and also serious intention. How do we, to broadly mitigating the problems that may arise through expanded gambling. So today is another step in that same spirit. It's let's implement expanded gaming as thoughtfully as we can. Let's raise the bar on how we're doing responsible gambling in the United States. So in a nutshell, what I'm hoping for from today, we're hosting a forum. Information drawn from this forum will provide a foundation for a responsible gaming framework for Massachusetts. This is our chance to begin to take a stand on the numerous issues related to this matter. As we develop a framework, we will draw on guidance given from the statute, from the science that's available, as well as from the best and most promising practices that are in the field today. We've very thoughtfully invited a whole host of panelists. They're recognized experts and innovators in their respective fields and the work that they do. They're going to share their experience, their insight, in many cases the research that they have done as principal investigators, all of which will be an invaluable contribution to this process. So before we go any further, thank you to our panelists who have come from near and far. We have them from Canada, we have them from Boston, we have them from New Jersey, and places in between. I look forward to seeing what you have to say as we begin taking a look at this critical issue and developing a creative approach to a responsible gaming. So what the responsible gaming framework, as I see it, is going to serve many functions. First and foremost, what are we going to do with it immediately? The framework will be used as a guiding document as we draft the initial regulations to address problem gambling and responsible gaming at sites that are regulated by the Massachusetts Gaming Commission. Second, it's going to inform our orientation as a commission on responsible and problem gambling issues as we continue to grow as an organization and as we work in collaboration with a range of stakeholders, including but absolutely not limited to the Massachusetts Department of Public Health and the Massachusetts Council on Compulsive Gambling. I think it will also assist gaming operators in understanding what practices they need to have in place. While we are regulators and we can also be collaborators and co-innovators with successful applicants to promote responsible gambling and to mitigate problem gambling. So I want to circle back and give you some of the basics in terms of what are the definitions of what I'm talking about here. So our working definition for responsible gambling. Responsible gambling is the provision of gambling services in a way that seeks to minimize the harm to customers and to the community associated with gambling. When I talk about a responsible gambling framework, this is a set of concepts and practices that are intended to reduce or eliminate the harms that can be associated with gambling while simultaneously maximizing the potential benefits of gambling. There are a number of frameworks out there that with varying orientations on responsible gambling. Some of those frameworks were created or co-created by persons that are here today. And I think it's imperative that we take a look at these frameworks, hear what they have to say, but I also think that it's equally important that we, as the Massachusetts Gaming Commission, understand what the needs of Massachusetts is and develop a framework that specifically speaks to those unique set of needs. There's a number of potential practices that can be incorporated into a responsible gaming framework. I'm going to identify some of those, but please understand that we're going to circle back around to those as the day progresses. Informed decision-making and player information about the nature of gambling. What are the statistical odds of winning? What are the average payouts per machine? Information about how gambling really works. Common misperceptions that encourage false beliefs about the probabilities of winning. We're going to talk about curriculum-driven casino staff training on problem gambling and responsible gambling. We're going to talk about the health warnings and promotion campaigns about the risks and consequences of excessive gambling, the signs of an emerging problem with gambling, and the sources and access to information and assistance. We'll talk about available and accessible voluntary self-exclusion options. This includes that are protocols for encouraging persons seeking self-exclusion to also seek treatment or other forms of help that are available. We'll talk about establishing practices for advertising and marketing materials that display responsible gambling messages and follows responsible gambling guidelines. We'll talk about the use of loyalty player card data coupled with behavioral analytics software to provide information targeted to players showing signs of problematic gambling behavior. We'll talk about restricting technology design features and environmental variables that may contribute to excessive gambling, including bill acceptors, free spins, the availability of ATMs within gambling venues, and features that promote false beliefs like near wins and the speed of play. So another term that you frequently hear around this issue is harm minimization. As defined by the Australian Institute on Gambling Research, harm minimization policies are intended to reduce the social, financial, and emotional risks that can be related to gambling. The main aim of harm minimization is to reduce the likelihood of damaging consequences of gambling through introducing preventive measures. Prevention is targeted through promoting responsible gambling practices and a safe gambling environment. So why is this important? First, it's essential to the work of the Commission. In fact, if you take a look at the responsible gambling and mitigation of problem gambling, it's woven into the statute that defines the work that we do. That's been taken and it's embedded in the core values and mission of the Commission, which is to provide to the greatest extent possible economic development benefits and revenues to the people of the Commonwealth, reduce them to the maximum extent possible the potential negative and unintended consequences. Keith White, who I like to use a quote from him, he's one of our speakers today. If we really want to maximize the benefits of gaming for the people of the Commonwealth, then we must simultaneously work to minimize the harm. To reiterate this, to maximizing the benefits means that at the same time we have to minimize the harms. So while we will be discussing the broad policy issues today, it shouldn't be separated from the impact that it has on the individual. We have an opportunity here to implement measures to avoid loss and devastation that problem gambling causes, not just to the individual, but as it ripples out to their families and to their communities. I'm going to turn it over to Commissioner Crosby here in just a second, but before I do that, I want to recognize, I'm sorry, Chairman Crosby.
It's okay.
I want to just recognize the assistance that I received from the staff at the Commission in organizing this, but also, and very importantly, one of our partners, the Massachusetts Council on Compulsive Gambling. They have been with us, I think, since the onset, really, in trying to define where we need to go on a number of issues. The Massachusetts Council on Compulsive Gambling is our co-organizer, and since 1983, the Council has been a vital voice in defining and responding to the issue, not just for the Commonwealth, but for a number of different, for basically around the country. Their purpose is to reduce the social, financial, and emotional costs of problem gambling. And if you think about it, it is very in line with the work that we're trying to do at the Commission as well. So thank you, Marlene, thank you, Karen, and thank you, Brianne, the staff that had helped us. So I'm going to turn it over to Chairman Crosby.
Thank you, Mark. I'll be very quick. You've done a nice job in setting up sort of where we're coming from and what the issues are here. There are one or two points that I want to make. First of all, I just want to introduce the other commissioners who are here. All 5 commissioners are here and will be here all day, which says something about where we are coming from. Commissioner Enrique Zuniga, Commissioner Gail Cameron, Commissioner Jim McHugh, and Commissioner Bruce Stebbins. All are here. We all did our voluminous homework that Mark gave us, hundreds of pages of reading to learn about the issues of problem gambling. Mark made it clear that we are doing what the legislature told us to do. The legislature made it clear that they were anxious to get jobs and revenue, and they were anxious, on the other hand, to keep negative consequences to the barest possible minimum. The work that the council, the present leadership, and the prior leadership did in influencing this legislation to get attention to these issues was probably unique in the effectiveness with which you impacted this legislation. We're following your mandate as best we possibly can and with your continued participation. But before I make just one point about that, I want to introduce one other person who's here, whose presence I think says a lot about what this industry is trying to do. Jeff Freeman is the new president and CEO of the American Gaming Association. That is the top person in the entire country in the industry associations of the gaming industry. Jeff's only been in his job for 4 months, as you all know. The fact that he would take the day, I guess, you're going to be with us pretty much the whole day, to be here says a lot about what the industry is trying to do and the priorities of the industry. This is not just us. This is the whole industry that's trying to get its arms around this issue as constructively as humanly possible. One thing I'm very much aware of, and it relates to what we're doing in Massachusetts, is the limitations of what we're trying to do here. Part of our homework that Mark gave us was a report from, forgive me, but the Addictions and Lifestyles in Contemporary Europe Reframing Addictions Project, ALICE RAP. It's a European white paper, and it's a very thoughtful white paper, but it makes a point that is applicable to anybody in the business of problem gaming worldwide. And at one point, under what to do, it says, however, formulating guidelines that are effective in preventing harm and protecting gamblers also addresses a central problem in current gambling research. On one hand, high-quality, systematic analyses of the effectiveness of interventions in achieving the desired aims are scarce. On the other hand, it would be unethical to remain inactive and wait until more evidence exists. Therefore, decisions under uncertainty are required, combined with a careful monitoring of the outcomes and corresponding modifications in guidelines according to an adaptive learning process. Our legislation gives us a public health trust fund. When we are up and running, it will generate something in the range of $15 to $20 million a year, forever, as a percentage of gross gaming revenues, to do principally research and programmatic strategies with respect to problem gambling. Some broader interest in the research side to broader socioeconomic issues, but principally $15 to $20 million to deal with research and programmatic initiatives. And our mandate is to do the very best we can today with the best information that's out there. And by the way, there's a lot of this, as I read this stuff, yes, there is imperfect research, but there's a lot of common sense. And we don't have to tie ourselves up in knots trying to be perfect when that could be the enemy of the very good commonsensical approaches. But we are missing hard academic quality data on the impacts, and our project, and Mark as Director of Research and Problem Gambling, is to do the best we can possibly do now, and then on a longitudinal basis track forever how we've done, and make course corrections as need be, create a body of data that's available to everybody to study. It'll be widely available to everybody. So this is a huge ongoing process. The net of it is, though, we got to start somewhere, and we got to put a stake in the ground with the best research and the most constructive, most thoughtful, most provocative, boldest framework and structural outline of a program that we can possibly come up with to start the ball rolling. And that is the principal mandate of today. This will not be just a conference. There will be a work product that comes out of this with the help of all of our speakers. And we are excited about moving forward. We take this very seriously. We're pleased that you all are here. Hopefully there will be more because this is important. Thanks for coming, Jeff. Thank you for flattering us with your presence. And I look forward to an interesting day.
Okay, so as Chairman Crosby said, this is kind of a working forum in a lot of ways. The information that we're taking from here will be translated into a white paper, which will be our framework that we move forward from in many ways. And so with that, I'm going to introduce our first speaker, who is Marlene Warner. She is the Executive Director of the Massachusetts Council on Compulsive Gambling. Marlene is going to come up. She's going to give us a presentation. What we'll do is that we'll leave if there's time at the end, we'll open it up for conversation with the commissioners and any questions that they have. After Marlene goes, then we'll have Dr. Howard Schaefer come up. And Dr. Howard Schaefer is the Associate Professor of Psychiatry at Harvard Medical School. In addition, he's the Director of the Division on Addiction at the Cambridge Health Alliance. You'll have to excuse my brevity as I introduce these speakers. We have an amazing panelist of speakers. Each of them brings an incredible wealth of knowledge, an incredible body of research with them, and I wish I could expand on it more, but there's just simply not time. And so, so with that, I want to turn it over to Marlene. Thank you.
See, we're going to try to coordinate their computer with my computer so that we know what we're both doing here. And who's doing, are you advancing the slides? All right, excellent. Well, good morning. I'm so pleased I can be standing in front of you after a Red Sox win. It was going to be a hard morning to start off on any other way. So we've gotten through obstruction calls, we've gotten through, they're coming back to Boston, so it's going to be good. So, so thank you again for the opportunity. I really appreciate that each of the commissioners have been very, very, very committed to this. God bless Steve. He was emailing me moments after responding to my emails moments after he was asked to be chairman. And just as Mark said, everyone has been committed to this issue truly from day one. And truly, the council has walked hand in hand with the Gaming Commission as it relates to this. So thank you to all of you. I want to just be clear for anyone who's not clear who the Mass Council on Compulsive Gambling is. A private nonprofit health organization, as Mark stated. We have been around since 1983. Oh, sorry, forward. This is going to be hard because I usually do this myself, sorry. This gentleman, Thomas N. Cummings, started the council in 1983. I think it's really important to not only talk about Tom in particular, but to talk about what he represents, and that is all the people who have struggled in the past, currently, and certainly in the future with gambling disorders. That's at the very cornerstone of who we are and what we do, is making sure that we are a resource at a number of levels for people who will end up with a gambling disorder. Gambling's been around since the beginning of time, and people will continue to have gambling problems. But we're really here talking about a kind of more focused area, but it's important to remember why the council exists. The council secured funding, or Tom secured funding in 1987, which is when Kathy Scanlon, the previous executive director, also joined the staff and advocated for a treatment system literally up until the day he died in 1998. Next slide. I think the other really important key piece is to understand why it's us. Why are we the ones here talking with you today? And that is, our neutrality stance is a really key piece. It's a key piece for all of the affiliates of the National Council on Problem Gambling, so we're not alone in this. But it allows us a lot of, it's our position. It allows us to understand that gambling can be a problem for some folks and that there is an issue for some folks, but for many others, gambling is a fun, recreational form of entertainment. And so we're neither for nor against. We provide services and advocate for those people who might develop or are currently struggling with or are looking for support and recovery from a gambling disorder of any magnitude. And I think that's another key piece, is that we kind of look at it from soup to nuts. And I'll talk a little bit more about that in the future. Next one. And certainly we advocate for gambling, responsible gambling related public policy, which is, as Chairman Crosby alluded to, how we ended up doing so much work as it related to the expanded gambling legislation. Next slide. Our mission, Mark really covered, but I just wanted to be clear, you know, the kind of the key pieces that we really focus on are information and public awareness, education, technical assistance, and capacity building on a number of levels, advocacy, as we just referred to, helpline and referral. I like to talk about that being the backbone. It's how we remember every day who we are serving and what we are doing. And recovery support services, which has become more and more important to the work that we do. This might be a little hard for you to see, but I thought was an important piece to put in here. Ecological public health model, and I think the piece that's really important about this is that there's 3 circles there. We're talking about the biology, the environment, and the behaviors. And I think what's important about that is that there's not kind of one key person to hold accountable, that it's really group accountability when you look at a public health model for a number of things, but especially as it relates to problem gambling. This, you know, this reminds me a lot of how I was kind of, quote unquote, raised in the field since 2001. You know, really thinking about Dr. Schaefer and Dr. Korn's public health model, thinking about the Reno model. These are the very kind of foundational pieces that help me understand how to address problem gambling in the Commonwealth of Massachusetts, and are also very helpful in terms of thinking about how to proceed now as executive director. Sorry, let me just catch up here. And I think the other key pieces here are that the interdisciplinary approach. There are so few folks right now focused on this, although we have to say our phones have kind of been ringing since 2011 in a way that they never rang for the several decades prior. But it's important to kind of approach this with a number of different folks. Diversity, human rights, and social justice. Another piece, I think a lot of folks really focus on the mainstream gambler, you know, the folks that you see in the commercials, but there are all kinds of people impacted by gambling disorders, and we'll talk a little bit more about that in the future of this presentation. And then, kind of most importantly, what we struggle with, despite all of our great resources here in the Commonwealth, is movement from publication to public action, the science to service. Now, we are so lucky, obviously, to have NCRG's, one of their offices here in the Commonwealth, and so I have some great resources, and I happen to live in Salem, and their office is in Beverly, so we meet for lunch and we get to talk. So that's fantastic. I think that there's just so much more, though, and you know, I was just talking to Nathan this morning about there are some really key questions that we haven't figured out how to answer them, and I was pleased to hear the scientists don't have the answers yet either. But there's a lot of that, figuring out how do we move science to service. Next slide. Just to catch anyone up who's from out of town to kind of where we've been, from the late 1990s to 2011, a lot was happening in Massachusetts. I used to go around as program director doing all the trainings in the state, and, they referred to me as the gambling lady. Here comes the gambling lady, coming to take our last bit of fun away. That's how I was known when I walked in rooms. But there were 4 racetracks, 2 dog and 2 horse. For folks who are familiar, dog racing was banned several years ago, and so currently we have 2 horse tracks. The Mass State Lottery has been and continues to be the most profitable lottery in the world. And all kinds of illegal gambling. The number 3 biggest way people call us to our helpline is sports betting with a bookie. It's alive and well in the Commonwealth. Open the paper, right? See the lines, sit on the commuter rail home, and I hear everyone calling their bookies, so it's definitely alive and well. So sports betting, video poker, cyber cafes. We know that House Speaker DeLeo kind of went on a big rampage about a year ago around the cyber cafes, and that was a big piece. Cock and dog fights we've heard about. Years ago, I had gotten 2 calls about fish fighting, beta fish fighting. So people will gamble on anything, and certainly a ton of gambling at the fraternal clubs. So expansion bills for at least 10 plus years, many expansion studies, but we just didn't know enough. We knew that things were expanding, we knew a lot of gambling was happening, and we were trying to hit it where it was at, but there was so much to cover. Next one, Alicia. The other thing that we knew was that we didn't have mass-based data, but we did know that there were some really good studies out there. The most recent kind of comprehensive major study was done by Ron Kessler here at Harvard, the National Comorbidity Study, that told us that if you looked at the subclinical and clinical diagnoses or rates, you looked at about 2% to 3.5% of the U.S. adult population in their lifetime having some adverse consequences. Again, that's from subclinical on up. And based on these estimates, between 125 to 225,000 Massachusetts residents. But again, it's based on national data that we're still trying to figure out how it's relevant. Next one. And I think this is something that a lot of folks are starting to come to understand, but these numbers are still often surprising, which is there's really high comorbidity with other disorders. So with people who are likely to have pathological gamblers, which is not the term used anymore, but this is based on DSM-IV language. Pathological gamblers are significantly more likely to have mental health disorders and or substance use disorders compared to those without gambling disorders. So 75% estimated to have an alcohol disorder, 38% with a drug use disorder, 60% with nicotine. I'm also looking at bipolar or other mood disorders, 41% anxiety disorder, and then over 60% with a personality disorder. Really high comorbidity. So we know that, again, if I'm guessing Howard's not using this slide today, but has a great slide of all these intersecting circles, and so few people end up with just a gambling disorder, and it's absolutely what we're seeing, that the people who come and need our services and who we're reaching out to have so many different needs, and it's really a call to action for us to work with so many different providers in the community. So what has been our approach, our public health approach, up until 2011? Well, my staff hears me say this all the time. I talk about the sprinkle effect. We did a little bit here, a little bit there, but not necessarily as collectively as we would have liked. Dollars and interest were big forces against us, but certainly doing some prevention, a little bit in schools, certainly some colleges, working with older adults, doing some things in high priority populations, working a lot with an Asian initiative. We did a fair amount in Chinatown, a little bit in Quincy, and so some prevention. Intervention, a little bit using some tools that were out there, knowing that 2 and 4 question tools were available, using some of the screening options through some of the community health centers. Treatment, I'd say, was the biggest area where we've spent time and money in the Commonwealth of Massachusetts. We have had upwards of 16 treatment centers, and up until 2011, we had about 13 treatment centers. Those are outpatient treatment centers that the Department of Public Health manages, and we, in our contract with the Department of Public Health, we are contracted to build their capacity and provide technical assistance to those training providers or treatment providers. And then a little bit of recovery support. And I'd say a little, and we've done a lot more since then that I'll talk about in a moment. The other thing, and this was really at the leadership of Kathy, is that engaged in listening sessions, bringing together when there was a lot of kind of false starts, thinking that, yes, the gaming legislation is going to pass this year. The listening sessions were a great way for her to pull together various groups to say, what do you know that we need to know here in the Commonwealth? And so pulling together legislative representatives, industry members, folks from Executive Office of Health and Human Services, Executive Office of Public Safety, the Attorney General's Office, researchers, clinical and prevention professionals in Massachusetts and beyond, and folks in recovery. Next slide. And then, as we've been referring to it, then there was a game changer, and that was the legislation finally being passed, something people had been waiting for a long time. And there's Governor Deval Patrick and a number of the folks who have been very good on this issue and also have been very key in terms of the problem gambling work. Next slide. I'm going to see something if I can do this here. All right. Excuse me. These are really key pieces. Now, the commissioners, I'm very impressed you all did your homework because I saw the binders that left our office. So the fact that you read them, hopefully you read them on breaks from the Red Sox game. These are all pieces that really came out of the Reno model. And again, like I said, this was a really important framework. You're so lucky to have 2 of the 3 authors here today because it really has laid a foundation in terms of how should we look at this issue and whose responsibility lies where. So the strategic framework. So while the legislation is a great starting point, and I'm going to talk about some of those pieces that Chairman Crosby and Mark spoke to earlier in a few moments, while it's a great starting point, it doesn't effectively coordinate the efforts across gambling types. Again, we talked about how, our lottery grossed close to $5 billion, that's with a B, billion dollars last year. That's a tremendous amount of money, and so there's a ton of people already playing. We know from some of our research that I'll talk about in a few moments that for every man, woman, and child, about $721 is being spent on the lottery in Massachusetts. When you look at folks with some form of disordered gambling, those numbers go up tremendously into the thousands. It's a problem for some folks. It is a true problem, and so to not coordinate those efforts would be such a shame when we're looking at certainly expanding gaming into 3 casinos and a slot parlor. So that is another piece. The other piece is obviously the State Treasurer Grossman and certainly some members of the commission and others in Massachusetts are certainly looking at internet gambling, and I think we all agree that it's on the horizon. When and where and how is still being determined, but that is certainly something that's going to come forward. And so not including that in the conversation, again, would be short-sighted. Key stakeholders. So Chairman Crosby and Commissioner Zuniga were very kind to join us for a common agenda meeting in May. This was a really key piece to us. When I started as executive director in 2011, one of the things that we knew was that we had a 5-year strategic plan that had, oddly enough, we didn't put on a shelf and we used, and we had done most of what we had set out to do for those 5 years. And so we were ready for another one, and we sat down with a consultant who said, how in the world are you going to build a strategic plan when there's 5 different things going on in Massachusetts? And as we know, the plans and the reality and the truth keep changing. So we said, good point, and we can't do it all alone. We're not funded to do it alone. We're not qualified to do it alone. We need to bring all the different factors and groups together. So that's what we try to do. We really try to bring in the key stakeholders. We brought in gaming folks, industry folks. We brought in regulators. We brought in legislative folks. We brought in people from courts, people from Department of Public Health, Public Safety. We brought in folks that represent recovery centers. We brought in treatment professionals, prevention professionals, and again, certainly folks in recovery. It was a great day, and I'm going to go over some of those pieces, but I think identifying those key stakeholders and expanding those key stakeholders is going to be so important as we move forward in this effort. Conceptual clarity and definitions. This is another really key piece. So one of the things that I was talking with Nathan from NCRG about this morning was You know, the DSM-5 came out in May. The APA put out this new DSM-5. It's kind of revolutionary in a number of ways. It's been long awaited. And it has given us this term where it's moved us now from pathological gambling to disordered gambling, or gambling disorders. And, but it still hasn't even given us a lot of the language for what is subclinical, what is less than something that you could really bill insurance for. And so even having that definition, knowing what to call this, is really important. It's really important. So we're all on the same page to talk about severity, talk about what are the issues when it relates to this community versus this community. One of the things in Mark's previous job, I remember him talking about in Iowa, and one of the presentations I had seen him do was talking about how Iowa had done this tremendous job of making sure that most people knew about the helpline, and that they were really starting to focus on not folks with, you know, the most severe problems, but the folks that were, you know, might meet 2 or 3 criteria, and how do you get them kind of more in the mix? And I think that's so key, is that you really identify your interventions in specific ways. I think the other piece is, you know, and this is one of the things we'll talk about today, and Mark and I have this conversation all the time, is what does gaming look like? What does gambling look like? What are the definitions, even in terms of regions? Right? So the Gaming Commission is really working within these 3 kind of distinct regions. Department of Public Health is working within 6 regions. How do we figure out who we're even talking about in the state? How do we define that? So there's a lot of definitions that need to be clarified. Consensus regarding parameters. I think we are here to discuss this today, but the questions are so large that it's just kind of the tip of the iceberg. The who is in terms of responsibility and involvement. It's kind of really unclear so far. The what and the when is kind of debatable, as you'll hear this afternoon as well. Are we worried about incidence and prevalence? Are we worried about prevention or treatment? There's a lot to discover and figure out. And do we worry about Mass residents who are gambling in Massachusetts? Are we worried about Mass residents who are gambling anywhere, Massachusetts or the outside? Are we worried about the people who are out in other states and are gambling in Massachusetts and maybe creating some problems here, but then leaving with, who are we even talking about? So a lot of that is also kind of consensus building there. Sorry, this is a little. Data and evaluation. I think, you know, Steve talked about this earlier in terms of we have some data, we need so much more, and I think that is one of the true strengths of the legislation, is that is nowhere else has that amount of money and attention been paid to this issue. So I think that you know, I was saying this to Rachel and I saw her Thursday night. She's got a lot of work to do because there's a lot of information to uncover. And evaluation is going to be so key. Again, the whole world is looking at Massachusetts. Everywhere I go, people say, what is going on in Massachusetts? They're waiting to see, what do we find out? We have a tremendous responsibility on our shoulders. And education, you know, we're going to talk more about this today. Whose choices are they, and how do they make those decisions? And how can we, this collective responsibility group, help inform that? So quickly, I'll go through these. Problem gambling highlights in the legislation. Again, Chairman Crosby talked about the Public Health Trust Fund, the on-site quote-unquote treatment center, which I'll be speaking about this afternoon, statewide exclusion lists, the self and third party. There's a lot of questions about the third party piece. And certainly self-wide exclusion and having that be statewide is another important piece that's not being done in a lot of other places. Helpline numbers being posted and being posted in multi-languages. A very robust research agenda, as I pointed out. A gaming policy advisory committee was required as part of this legislation, and having a subcommittee specifically on addiction and naming specifically the Mass Council on Compulsive Gambling, a really key piece. Next slide, please. Guidelines on credit extension and check cashing. I'd say that this is one of my kind of biggest areas of concern, and I think there's a lot more conversation to take place here. And this is something certainly that commissioners have been asking about since we did our first forum last June, where folks talked about getting these ridiculous extensions of credit despite not having the means to back that up, and being able to cash checks at the Connecticut casinos in a way that they couldn't do in some other states, and that was a roadblock for other places but not for here. Responsible gambling guidelines on marketing was included in the legislation, payback statistics posted, smoke-free environment, that's a huge public health piece. Years ago when I was talking to folks from some of the casinos and they were talking about how Massachusetts was the last frontier for gambling and they were so excited in Massachusetts once the legislation was passed. They said, oh man, but we just hope those casinos aren't smoke-free. It's a real concern for the casino industry, and I think it's a really interesting and probably important piece as it relates to the comorbidity issues and how this relates to problem gambling. Again, another interesting thing to study. And then another really key piece is the gaming divisions of the Attorney General's Office and the State Police. Another true opportunity to make this interdisciplinary, I think in a way that we just haven't seen in the past. Some important collaborations and partnerships moving forward that we have really relied on tremendously. Regional collaborative meetings for treatment of priority populations. So again, referring to the sprinkle effect, we have had all these different treatment centers, but they haven't been talking to one another. They talk to us. And we said, this work is going to get important enough and is going to become robust enough that we aren't going to be able to be the only ones that you speak with. You have to speak to one another. And so really building those groups. We've been pulling them together, making sure that they have their own dialogue with one another, both on the treatment side and in prevention of priority populations. We've also been trying to further engage community groups from a whole plethora of areas and making sure that they understand the importance and formality of this issue, that it is science-based, and so establishing MOUs has been a nice way to start to do that. We developed a municipality checklist, and one of the things that I've recently done is hired Brianne, who's in the back of the room there, and one of the things she'll be doing is working with all 351 cities and towns, while probably starting with some of the priorities will be with the host and surrounding communities of the casinos and slot parlor. We know, again, all 351 cities and towns are host to lottery agents. We have nearly 7,600 lottery agents in the Commonwealth of Massachusetts. So it's important to make sure that those municipalities are ready. They're ready for either the current gambling problems. I had a mayor tell me just a few months ago that they have absolutely no gambling problems in their town, and they, if a casino is not cited there, he's not worried about it. Well, he's fooling himself because just last Thursday I met someone from his town who said he's had a lifelong gambling problem, and I'm sure there are plenty of other people like him. And so I think bringing that awareness to that community level and helping them to say, you know what, this does not need to be costly. Let us as a statewide organization help you get connected to the right resources, help you identify what's in your community already, and we can come in and help build that capacity. Again, Mass Gaming Commission has been an important collaboration and partnership for us, and certainly they've listened. You've listened, and you hired Mark, which has been fantastic. Mark has a really unique position, as you all know, in terms of gaming commissions. There's a slightly similar position in Pennsylvania, but really no one has been committed to this issue in the way the Mass Gaming Commission has been, so kudos to you. Another really important piece has been the Mass Partnership on Responsible Gambling. This was started years ago, had served a certain purpose, kind of had gone dark for a while, and then we brought it back in 2011. This is an industry association group right now, and we're hoping to continue to expand it. We have many of the, not all, but many of the current bidders for the 11, out of the 11 bidders for the slot and casino bids. We also have the Mass State Lottery. We've had the New England Convenience Store Association. We're hoping to have more vendors and industry members join and then continue to expand that out to community groups. It's a great way for us to further catch the groups that we want to connect with. And they are doing a lot of common goals and language despite being competitors in the room. They also are looking at what are some of the unique and interesting ways to train their employees and doing a lot of education and public awareness. Next one. I'm going to run through these because you, I'm sure, are much more interested in listening to Howard than me. But the developing a common agenda, there is a lot of information here. Basically, when we sat all those key stakeholders down, we came up with a lot. So I'm just going to read the top ones and kind of run through them. Increase public understanding of all facets of problem and responsible gambling through a broad-based focus on education. So education was a mainstay that kept coming out of that day. Next one. Minimize harm through a broad-based public health approach that's data-driven and fact-based and use scientific evidence and best practices. So we know not all reality comes from science, although some of the scientists might disagree with me in the room. But what we do understand is that to lend credibility to the work that you do, it's so key. And so we wanted to really make this a true focus and make sure that that was fact-based and data-driven. And so that might come from some community data, but trying to use scientific evidence to move that forward to a best practice. Next one. Ensure broad-based coordination, both regionally and statewide, among treatment providers, public health, industry, regulators, recovering gamblers, and their families and communities under a strategic leadership structure. Actually, I'm going to say Chairman Crosby kind of pushed this issue that day, and I thought it was so key. Because again, I think he realized that day, and I think we have been realizing for a long time, is that not one organization can handle this alone. It is a collective responsibility. I think that's the key piece of today. Whose responsibility, what falls where? I will say that out of all these different things, and I'll go through the next three, but the Mass Council then took our marching orders from this and said, what can we carve out and do? And these are our goals for the next 3 years. We've created our organizational goals from these. But now, one of the things I'm going to be doing is going out to the key leaders of all the different stakeholder groups that we had there and saying, we've taken this chunk, but here's what's left. What can you take on? What are the pieces that you feel like you can own? Next one. Promote prevention to fight it where it starts. It's pretty clear right there and can cover a whole lot of groups. Build a community of advocates to ensure strong social policy and ownership of the issue. Again, it shouldn't just be me up at the State House. It should be a number of folks up at the State House pushing for the pieces that are important to them. And not just at the State House. There's a number of ways to advocate. And Keith will recognize this. This is his. Ensure approach is multifaceted and ongoing following the Peter Principle: prevention, education, treatment, enforcement, and research. I will say for the Mass Council, we added recovery at the end. I am going to skip over all this, but data is so important. We did a major Mass Council survey. Phil Coppell ran it, who's in the back of the room here, our data and research director. And one of the things that we found out is that there are some interesting pieces about Massachusetts that we didn't know. That whole report is online. We did a nice piece at the legislature back in September, and we're going to be doing that again in Worcester and trying to take that out to some of the communities that it really impacts. The data really kind of tells us a story about. So I'm not going to cover all this so that you can hear from Howard, but I'm going to skip through all this. So let me just stop there. You can not worry about that, Alicia. And just see if there's maybe a minute or two for questions. Okay. Do you need this, Howard? Thank you very much.
Thank you.
Good morning.
Good morning.
I want to thank Commission Chair Crosby, Commissioners Zuniga, Cameron, McHugh, and Stebbins, and Mark Vanderlinden for inviting me here today. This is certainly a very important day, and because of its importance, because of the topic, I want to dedicate my comments to the memory of my friends and colleagues, Tom Cummings and Joanna Franklin, who would indeed be very, very proud that we're talking about these issues here today. And my topic, as you can see, is responsible gambling from concept to practice. I'm going to take this topic on in a fairly straightforward way. I want to share something about the concept and something about the practice or operationalizing the concept so that you can have some ideas that probably will both bother you and help you alike. Next slide. I'm going to be very quick, so try and keep up with me. If you can't, I'll holler. Let me begin by doing what we're required to do at Harvard and tell you these are the organizations that fund my work. I don't think I have any conflict of interest. If anybody thinks that my comments are conflicted, please let me know. Gambling has a long past, but a short history. My colleague Peter Nathan said this a number of years ago. Peter is perhaps the father of alcohol treatment in America, who got very interested in gambling. And he wanted to remind us all that despite the fact that people have been gambling since the beginning of recorded history, what we know about gambling, the science, the history, the recorded history, is actually rather brief and recent. So the science is short on issues of responsible gambling. So my objectives for this morning, I want to consider, as I mentioned, the concept of responsible gambling. I want to discuss the practice as distinct from the concept and the strategy of responsible gambling. And I want to describe some of the values that are relevant, because the science is short, the values become critical. And here we are at the hub of the universe, so to speak, Boston, where all values seem to have originated. Next, please. So if you think about it, science tells us about what works. Values, however, guide us about what to do. Here we stand on the precipice of a what-to-do question in the face of limited science. And I had to throw this in. Art reflects how we do what we do. And it seems to me that that's the style of life. But make no mistake about it, the science is short, the values are long, and you will be forced, as as Chair Crosby already emphasized, you will be faced with making decisions because you have to, you're obligated to. It's a social obligation, and you won't have all the information necessary to make that decision. I want to talk a little bit about that today. So let's start with the concept. Some ideas have already been put forward, so I'm going to be moving rapidly through these ideas. By responsible, we mean having the job or duty of dealing with or taking care of something or someone. We mean by responsible to be able to be trusted to do what's right or to do the things that are expected and required. And usually responsibility involves important duties, decisions that we trust people to do. So there are a lot of people trusting us, trusting the commission, trusting the state legislature to do the right thing about gambling. And the responsibility, of course, applies both to individuals, companies, groups, and even commissions. So we all have a responsibility with respect to responsible gambling. So let's take a look at responsible gambling. It was born out of the idea of responsible drinking programs. That's where the idea came from. The first responsible gambling programs were created in Canada and the Netherlands. They're derived from public health or corporate social responsibility perspectives. The focus on population level effort is primary to responsible gambling programs, even though we will occasionally deal with individuals. The idea of the program is to affect large groups. And some of those groups are vulnerable. For example, underage gamblers, disordered gamblers, high-risk gamblers, and so forth. So now let's move to from responsible gambling to responsible gambling programs. Responsible gambling programs are evidence-based initiatives designed to prevent the incidence, the number of new cases, and reduce the prevalence of gambling-related harms. We tend to think, I think, disproportionately about the prevalence of gambling problems, but actually stopping new cases is a central aspect of responsible gambling programs. And these are, in fact, different, contrary to a couple comments already this morning, but I think they're different from treatment and harm reduction efforts because treatment and harm reduction efforts focus on gamblers who already have problems. And responsible gambling programs really should be focused primarily on people who don't, but include components for people who do have these problems. This is a bit like a cold shower, my next comment. We have to do it, but you may not like it. And that is that a responsible gambling initiative requires us to distinguish strategies from tactics. Unfortunately, almost everyone involved wants to talk about tactics. The agenda for today is a tactical agenda. It's not strategic at all. And the strategic issues determine the tactical issues that you'll include in your responsible gambling program. Strategy establishes the goals against which we evaluate the influence of tactics or practices. It sets our broad strokes agenda. Once we implement some initiative, we have an obligation to determine, one, whether the elements of our responsible gambling initiative are being applied in practice. It's easy to set a law or regulation, but it's not so easy to check and see whether people are doing what they're supposed to do. Two, science can do this. Are they effective? Does the responsible gaming components do what they intend to do? And do they have some impact, meaning do they attract the right people? And finally, the program reflects the values of the community. Responsible gambling programs ultimately are a reflection of community values. So the first task is one of regulators and policymakers. The second task is the task of scientists. Dr. Voldberg will be telling you about how the patterns of gambling change throughout the state. And the last task, the task of values, is the task of ethicists. And we're going to talk a little bit more about that. Now, the Reno model has already come up this morning. Marlene introduced the Reno model. It provides a strategic playing field for developing responsible gambling initiatives. And it's intended to stimulate an enduring dialogue about responsible gambling concepts and initiatives. It really laid the playing field out, and Alex Plazinski and Robert Ladouceur were my colleagues on this, and you're going to hear from Dr. Ladouceur later today. So this leads us to the question of who's responsible for responsible gambling. Well, it seems to me that there are many people responsible. Consumers, the players, purveyors, the operators, the government, regulators, healthcare providers, and interested community groups, those both on the pro side and the anti side of gambling, all have an important stake in responsible gambling. Ultimately, everyone's responsible for responsible gambling. And I couldn't help but be reminded of the last speech given by Senator Hubert Humphrey. He reminded us, and you've heard this in many different ways, but these are the words of Hubert Humphrey: the moral test of government, you can think about this as the moral test of community or society, is how the government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped. These are all the people for whom we're going to put together a responsible gambling program. These are the targets, so to speak, of our interests in terms of gambling and many other things. These are the people who are counting on us to be responsible. So what are the institutional foundations of responsible gambling? Well, corporate social responsibility departments provide the foundation upon which operators build responsible gambling programs. So corporate social responsibility programs are critical. Public health departments, on the other hand, provide the foundation upon which governments create responsible gaming programs. So you've heard a lot about public health approaches already. David Korn and I were the first, I believe, to apply a public health approach to gambling. And having done that, we've now seen those ideas adopted all around the world. I'm here to say that that's not the only way to view these kinds of problems. It's become a very popular way. And I'm a little bit like Groucho Marx. I don't really want to be a member of anybody that would have me as part of the club. So I'm concerned when I see everyone beginning to take a singular perspective about these kinds of matters. I do think a public health approach is very helpful and important to this discussion. I simply want to remind you, it's not the only way to think about these kinds of things. So Harvey Skinner from the University of Toronto commenting on the public health model, said that the public health perspective is that it applies different lenses for understanding gambling behavior, analyzing its benefits and costs, as well as identifying strategies for action. This is the driving force behind a public health approach. My colleague Jeff Daravinsky said, but referring to the gambling field, this is a field that's not without controversy. This is a complicated endeavor, and I'm sure that both the commissioners and the legislature and everyone here already knows that this is a field not without controversy. Mark Van der Linden said in some correspondence not so long ago, when referring to responsible gambling, not just the gambling field, it's a complicated endeavor with more problems than answers. We're in a minefield. So let's think about who we're talking about. Let's start with public health language to describe gambling problems. Level 0 is the people who don't gamble. Level 1 are the people who gamble with no symptoms. They don't have any problem. We think of them as recreational gamblers. Level 2, people who gamble but have some level of symptomatology, but they might not meet diagnostic levels. Level 3, people who actually meet some diagnostic standard. They meet some code. And level 4, which often gets left out of this system, is the prevalence of people who actually seek help. And believe it or not, there are people who will seek help for gambling who don't meet diagnostic code. And then there will be many, many people who meet diagnostic code that won't seek help for gambling. So let's look at a framework for public health action so you can see where you can apply responsible gambling principles. There are a range of behaviors. The first are the non-gamblers, people who don't gamble. Then there are people who gamble healthy in a recreational way. And then there are people who gamble in some unhealthy way. As you can see, this is not the DSM, the diagnostic manual, because I know there'll be DSM-6, 7. I'm trying to live to double digits. There's always a new diagnostic code. But this is a public health principle. This is the responsibility we have, is to take care of our people who are healthy and maintain their health, and for the people who are not, see if we can help them. Well, they have a range of gambling problems that range from none to severe. And here comes the opportunity for responsible gambling programs and activities. There's a range of interventions. And they range from, on the left of that mark, if you can't read it, primary prevention, then secondary prevention, and then on the right, tertiary prevention or treatment. We have an obligation, though, to promote health for the healthy gamblers and to reduce harm for the people that have problems. And those harms might be minor for the people who are fundamentally healthy gamblers, and they might be major for those that are unhealthy gamblers. So we think of that as treatment, from brief to intense. But make no mistake about it, all of these elements provide the foundation for responsible gambling programs. Well, if we talk about responsible gambling programs, we have to talk about irresponsible gambling programs, because how do we know the difference between responsible gamblers and irresponsible gamblers? And irresponsible gamblers, by the way, are not always people who are sick. They're just irresponsible. So they're different, but their features often overlap with disordered gamblers. So synonyms for irresponsible, I like these: reckless, rash, careless, thoughtless, foolish, impetuous, impulsive, delinquent, derelict, negligent, harebrained, kind of like adolescence. So adolescence is a time-limited disorder, and they engage in all of these kinds of behaviors. But if you think about it, adolescents aren't necessarily diagnostically ill in the sense that we think of mental health problems. For the most part, irresponsible behavior reflects observer values, sometimes by some legal determination. The courts, for example, often determine who's responsible and who's irresponsible and what it might cost them. Even the DSM reminds us that gambling disorders should be perceived and considered in a cautionary way, that the diagnosis of disordered gambling may not be exculpatory, unlike other mental illnesses. So, for example, Here's our problem. It's a taxometric problem, really. Taxometrics referring to the categories by which we identify and consider extreme behaviors. Is the behavior of an ill gambler different than the behavior of a recreational or healthy gambler? And so far, the science on this suggests no. The behaviors may be more intense, but they're not different. So we have all kinds of illusions of control, for example, among recreational gamblers that are also prevalent among ill gamblers. So here's an example of some fellow that comes into the emergency room at one of our great teaching hospitals in Boston, and the nurse says, well, he has pallor, shakes, nausea, fatigue. One of the team says, well, this must be a flu outbreak, and the nurse correctly says, no, it's Red Sox playoff time. We can't really identify with the precision required what a disordered gambler is. We simply can't do it. Science isn't there yet. We can do it on a population level. We're pretty good at identifying the prevalence of a disorder. But when you do that, you apply a screen, and the screen won't identify the same people. So scientists tend to use multiple screens. The point is, at the individual level, we're imprecise. At the group level, we have some level of precision. So now let's think about the practice of responsible gambling. What are the parameters for safer gambling behavior? Well, there's little scientific evidence, as I said, that would specifically direct us to build a responsible gambling program. There's some, but it would require a leap, I think. So most responsible gambling efforts are guided by community, corporate, and individual values. It's values that will drive Massachusetts responsible gambling programs, at least at the outset. Once we have data, we can begin to revise. So the Declaration of Independence reminds us that we have the unalienable right to pursue life, liberty, and happiness. My old colleague and friend George McGovern, Senator George McGovern, reminded me in a very poignant way. He said, two of these will almost always be at odds with the other. So despite the fact that we have a three-part model for the pursuit of rights, those who pursue happiness will almost always be at odds with someone who might pursue life, for example, or personal liberties. And Benjamin Franklin, we should remember, said, those who would give up essential liberty to purchase a little temporary safety deserves neither liberty nor safety. The boundaries of responsible gambling programs are set by our values. So we need to remember Benjamin Franklin as we move forward, because there are efforts at responsible gambling programs that would have us remove liberty. And the older I get, the more I agree with Benjamin Franklin. The younger I was, the less I agreed with Benjamin Franklin. Especially during my training, I really thought health was more important than liberty. I'm not so sure anymore. So, if we're going to talk about values, then I think we need to talk about values at the highest level. As you begin to contemplate responsible gambling programs and their various elements, what are the value judgments that you need to make to decide whether and how you want those tactical components? My colleague Wes Boyd, a psychiatrist and ethicist, suggests that there are four basic ethical principles that we need to consider. We need to consider the principles of autonomy or free choice, beneficence, to do good, non-maleficence, to avoid doing harm, the old medical ethics notion of do no harm, and justice. We want to be fair. And I think I want to suggest to you this morning, again, a little like a cold shower, that these principles ought to be guiding our strategies and tactics as we build responsible gambling programs. We need to think about these values as we make choices. So what are the strategies? I'm going to go very quickly here and I think I'm on time, Mark? Am I? Perfect. What are the strategies of responsible gambling initiatives? If you look at the last 10 or 15 years in the United States, you can see that strategies tend to target the initiation of gambling, gambling and gambling-related activities, and the consequences of gambling. And the kinds of programs are things like awareness, prevention, advertising, to deal with initiation, to deal with gambling, signage, employee training, alcohol service efforts, credit limitations, and loss limits, and finally with consequences, self-exclusion programs, helplines, and treatment programs. We have a lot of this already in Massachusetts through the Mass Council on compulsive gambling. But what are the strategies? See, people jump to the tactics too fast. From a strategic level, we want to talk about fairness of the game, minimum core information for players or potential players, protection of vulnerable players. See, these are at a different level of analysis. This is not what you do. This is what we're obligated to do in many ways. And there are many of these things here. I'm not going to bore you with all of them because there are a number of different ways to think about strategies. Let's just jump to tactics. My comments are a bit recursive. If you think about tactics in the United States, again, since 2002, I just took a sample of states and their responsible gambling activities. These are the things that the states are doing. You can notice that not all states do all things. That's the point. Different states choose different things because they reflect their values, not because science told them to or not to do something. Next, please. But what you'll notice here, and I apologize for the garbled slide, that most efforts are being paid to gambling and the consequences of gambling, and only about 13% or so are being paid towards initiation of gambling. So prevention is not getting the attention that treatment and other consequences are. That's not unusual. That happens in most areas of health, actually. So the public health triad provides you with a different way of thinking about your strategies and tactics. We might want to attack the host, the player, for example, and the characteristics of risk that they bring to the problem. We might want to attack the agent, the gambling delivery technology, though there's really no evidence to support that. And you can also attack the environment or the context within which people gamble. Our forum today has a number of topics this afternoon. I would argue that almost all of these are tactical, not strategic. And if you take up your responsible gambling considerations from the tactical point of view, you're putting the cart before the horse. You need to decide first what your values are in order to establish strategies. And from the strategies, there are many, many, many tactics. Many tactics. So, for example, I was honored to participate in the SEN workshop, which is the EU's workshop to establish standards for gambling across the EU. They started with strategies and had a very interesting way of doing it. For example, they said they wanted to protect, I won't bore you with all of these because these are readily available, you can get this material. They wanted to protect vulnerable customers. Well, they had 21 ways of doing that. They wanted to prevent underage gambling, 14 ways of doing it. They wanted to combat fraudulent and criminal behavior, 16 ways of doing it. They wanted to protect customer privacy, 6 ways. They wanted to provide prompt and accurate customer payments, 11 ways. Fair gambling, 22 ways. Responsible marketing, 10 ways. Commitment to customer satisfaction, support 7 measures, and safe operating environments. This was the SEN view. I'm not suggesting that you do this, but you can see the strategy of adopting strategies first and then many measures. Chairman Crosby already mentioned the Alice RAP policy paper series. This refers to the EU's Addiction and Lifestyles in Contemporary Europe, ALICE, Reframing Addictions project. They went at this in a similar way, but they came up with different strategies and tactics. So let me just share their strategies. The tactics are in white, the strategies are in yellow. Their first strategy, protect consumers. The second, prevent underage gambling. The third, establish independent regulatory agencies. Fourth, guarantee responsible business behavior of gambling operators. The fifth and final one, provide access to services for treatment. The tactical approaches are described in the Alice Rapp papers, which the commissioners have, but I know that the rest of you can just simply log on, Google, and you'll find it. If we think about a tactical approach, exclusion programs, not so simple. This is a very complicated area because exclusion involves self-exclusion, which is where we jump to rapidly, and other initiated exclusion. Real exclusion programs, by the way, simply translate into, I'm not going to gamble. I don't have to sign up for that. I can simply decide not to gamble. So when you think about a self-exclusion program, they're all other exclusion programs. So the purveyors of gambling have every right to exclude customers for certain behaviors. So they can exclude people. That wouldn't be a self-exclusion program. That would be an other exclusion program. And then we have voluntary exclusion programs, and people can enroll in self-exclusion programs. These are like suicide contracts between psychotherapist and patient. They are useful for a percentage of the population. Dr. Ladouceur can talk about that, but they're not legally binding. People don't always behave in ways that they contractually agree to, and the contract is not always binding. So since I've already suggested that you're a bit ahead of yourself in the tactical level, let me suggest other activities that you might consider that aren't on the agenda today. And I'm going to be very brief because my goal here is not to suggest I have something better. That's not my purpose. My purpose is simply to kind of poke you and say, don't move and commit too quickly to a responsible gambling initiative until you've considered all the strategies and all the tactics. Steve Jobs said it, I think, perfectly. We need to think like a beginner. We need to think fresh about this to do the best we can for our citizens and our guests that come to Massachusetts. For example, we could match responsible gambling interventions to gambling setting and player characteristics. There's no reason to think that responsible gambling approaches one size fits all. We can engage in SBIRT, screening, brief intervention, referral to treatment, which now, by the way, is paid for by insurance companies and the government, both. Medicare and Medicaid pay for this service. It's been extremely successful with alcohol and drug problems. Well, we could screen our young people in our schools, pediatrician offices. We can screen the elderly. We can screen the broad majority of our adults. We can provide gambling screening days in Massachusetts. All of these are responsible gambling initiatives. We have to think about how we want to do it. So SBIRT is a possibility. And finally, I want to close by simply saying that if we don't evaluate what we do, and I know that we intend to evaluate what we're going to do, so I'm very happy about that, we can't really determine whether our strategies or tactics are effective, or whether they have the impact that's desired. In the program evaluation, I won't deal with every one of these issues, but the program evaluation steps that I've outlined here are not nearly as important as the arrow that shows up on the illustration. The arrow simply suggests that whatever you do, you need to feed that information back on the research side so that you can reevaluate your strategies and tactics. They will work even if they don't work the first time around. I'm very confident about our ability to intervene and help people live more healthy lives. But that doesn't mean that every one of our efforts works any more than it does when the Red Sox suggest that buying beer at the end of inning 6 or 7 is the end of beer in Fenway Park. Anyone who goes to Fenway Park knows that that policy for responsible drinking leads to hoarding of beer, spilling of beer, and drinking perhaps more beer than they might have drank if there had been no policy. So this is a very tricky area and one of considerable importance. So I think I'm at time, so I will stop there, and thank you very much again for having me, and I don't know whether we have time for questions or not. I'll leave that to you.